the Chinese city of Foshan is going viral for all the wrong reasons. It's battling an outbreak of a mosquito-borne virus called Chikungunya. The virus causes fever and severe joint pain, and while it's not usually fatal, there have been some deaths. What do we know about this outbreak? Should you be worried? Here's what you need to know. It's not the first time that China has battled this virus. Outbreaks of chikungunya have been reported in many parts of the world, including India, where it's most common. The virus is transmitted by the bite of an infected Aedes mosquito, and once a person is infected, they develop symptoms like a high fever, severe joint pain, muscle pain, headache, nausea, fatigue, and a rash. While most patients recover fully, some can experience symptoms for months. The elderly and very young children are the most vulnerable. Fatalities are rare, but do occur. There is no vaccine or cure. Treatment involves relieving symptoms, so how is China responding? Well, they're taking the usual precautions, spraying insecticides, focusing on areas where the virus is spreading, and finding businesses that don't comply with anti-mosquito measures. But those measures are now including cutting power to homes. Residents have complained that their air conditioners and fans were switched off by the authorities. And while this might sound extreme, it's not unprecedented. During the COVID lockdowns, power was cut to some people's homes in an attempt to stop the spread of the virus. How big is this outbreak? Well, over 2,000 cases have been reported in the Guangdong province, with more than 1,000 of those cases in Foshan alone. The outbreak was first identified in April, and most of the cases are concentrated in this region in the south of the country. There have been 6 deaths, all of them elderly patients with underlying health conditions. Should you be worried? Well, the virus doesn't spread from person to person. You can only get it through the bite of an infected mosquito, so the risk of you catching it is very low unless you're replanning to travel to the affected area. The US has issued a level to travel warning, which means that travelers should exercise increased caution. But the World Health Organization says that the risk of the virus spreading internationally is low. The Aedes mosquito doesn't travel well, and most of the time when people do travel, they use air conditioning, which doesn't make the best breeding ground for mosquitoes. So while it's not the end of the world, it's certainly something to keep an eye on. If you do travel to affected areas, make sure you take precautions. That means wearing long clothing, using mosquito repellent, and making sure your accommodation has mosquito nets. But if you do get bitten, seek medical attention straight away. Early treatment can help prevent the virus from developing into a more severe infection.